Go.
Welcome to Drunken Medicine. It is another episode. We're so excited to be here. And we are drunk on medicine and we're passionate about whiskey. My name is Mike. I'm an acupuncturist. If you've tuned in at all, you know a lot about me already. I've been practicing for over 13 years, closer to 14 at this point. Treated, about a million different things. Exaggeration for flair, but a lot of different things. And helped a lot of different people. And this is Dr. May. Introduce yourself, Dr. May.
Hi guys. You have flair, Mike. That's fun. So I'm Ash. I'm a naturopathic physician, 13 years of experience, just helping people solve really difficult questions, and mostly focused on endocrine disorders. At this point in my career.
Nice. What are you drinking today? Are you drinking anything today?
I am. I've got a local here. I'm really excited to share this with you guys. So this is called Belton Bridge. Now it's
Ooh,
by
pretty bottle.
Glacier Distillery Company. It's here in Northwest Montana, just outside of Kalispell. And this is really interesting because we're close to Glacier National Park. And the Belton Bridge was built in 1920 and served as the west entrance to Glacier National Park until 1938, when the entrance was moved to its current location on the Going to the Sun Road, which is the road that goes into the park. In 1964, when a historic flood wiped out the new bridge, the Belton Bridge temporarily resumed its original role until another bridge was built. Today, the old bridge, as it's known to locals, still spans the river and serves faithfully as a footbridge and as a place to gather and swim after a day of adventure. So, pretty cool history there, and actually it tastes pretty good too. It's very cinnamony and sort of vanilla accents to it. So,
nice.
Yeah, it's a pretty smooth one.
Going to the Sun Road is awesome. That's a great name.
Yeah. Oh yeah. It's really cool this time of year too. Before tourist season starts in June, a bunch of the locals ride their bikes up because there's not a lot of car traffic. They actually don't let you drive up very far, but you can ride your bike all the way up, so you don't have a lot of auto traffic to kind of worry about while you're riding your bike up there. So it's a beautiful ride.
Man, that sounds awesome.
Yeah, and I have my just heavily overpriced little cup that I'm drinking it out of that I got at the distillery too.
Now, if you guys can't see this, if you're listening, the cup is covered, so he could literally pour as much as he wanted in there, and you wouldn't be able to tell how much is in there.
That's right. I could. But we're talking about high blood pressure today, which alcohol can contribute to. So I'm trying to be responsible here and not be excessive.
Mm-hmm. Mm-hmm.
That's my story, and I'm sticking to
it. Well, I'm excited because I got one of my favorites that I haven't had in a few years now. So this is Talisker Distiller's Edition. Really good. Talisker's on the sea in Scotland, the Isle of Skye, and wonderful. And it says made by the sea, but what's really cool about all Talisker products is you can actually taste and smell the sea.
Really?
Like it's got that salt seaweed brine that every single one of their products, because it picks it up while the barrels are sitting there from the ocean because the wind's constantly blowing.
Oh. Doesn't taste like seawater, does it?
No, but it's just this mild saltiness.
Smell.
Yeah, and there's a mild saltiness, which I really like because it accentuates the flavor of the Scotch. What I love about this one is it is peated, but it's not super peaty. The peaty is that punch you in the face. Like a lot of people don't like it. It's really strong. Yeah. This is moderated really well, very mildly peaty. And the reason is because they use sherry casks in the Distiller's Edition. So you get a lot of that sweetness of the sherry that cuts through it.
Yeah. And I really like when they finish it in sherry or rum as well. Mm-hmm. Like we've talked about this before, but one of my favorites is Basil Hayden by Jim Beam. And they have one where they do a rum finish. And it makes it just a little bit more smooth and just where you can really enjoy drinking it neat. You don't have to mix it with anything.
Oh yeah, and that's this one too. It's 45.8%, which is pretty much all of their products across the board. And it's actually perfect. Like I like that they didn't decrease the percentage. Like they taste really good at 45.8. You don't have to add anything to it.
Yeah.
Like they're perfect the way it is. So I hope they never go down to 43 like Lagavulin did, which I think was a
Mm.
huge mistake. But we're not going to get into that because it's a medical
All right,
podcast.
all right, all right. Good segue there.
So we're talking about hypertension today. So I'm going to ask for kind of the Western perspective again from Ash here because he knows a lot about this subject. So I'm going to turn it over to you. Tell us about hypertension. What is it? How do you measure it?
Yeah. So hypertension or high blood pressure. So this is one that I think we know a lot about, but we still don't give it enough credence as sort of a population. It's just like, you get your blood pressure checked, at your doctor's office maybe once a year, and maybe it's a little on the high side. And oftentimes we just like, eh, whatever. It's like, oh, I was stressed today, or it's been a busy morning, or, whatever. And we just kind of brush it off. But this is one that can be really significant. It's called the silent killer for a reason because it's just there in the background, damaging your arteries and your heart little by little, small amounts over long periods of time. So give it 2 or 3 decades of that, and then boom, you're going to have a heart attack or a stroke or something else. So this is one that you can really change significantly with lifestyle modifications, you know, even medications in small amounts, small doses early on can be extremely effective. But it's all about prevention here. Like we have to change our mindset on this and not wait till it gets extremely high before actually doing something about it. So let's talk about what blood pressure is and some of the contributors to high blood pressure.
Hmm.
So blood pressure is pretty simple. It's just basically the pressure inside your arteries. Now, if you get your blood pressure taken, you're going to have two numbers. There's a top number and a bottom number. Now, the top number is the pressure in your arteries when your heart's contracting. That's why it's the higher number typically, because it's a higher pressure. And the lower number is pressure in your arteries when your heart is relaxed. So it's in between beats. That's why it's the lower number. So a typical blood pressure for most Americans is 120 over 80. That's what we consider sort of normal, right? Now we're starting to see some evidence that that may not actually be the case, especially if you have other things going on. Having a lower blood pressure than that could be much more protective. 120 over 80 might not be as protective as we initially thought.
Hmm.
So there's some movement to try to sort of lower that number, and we can speculate as to why that is. The pharma companies wanting to sell more blood pressure medications or whatnot,
Hmm.
but I think some of the evidence actually does look pretty good to lower that number and try to be as low as possible while still functioning. Granted, if we drop our blood pressure too low, you're going to get lightheaded and dizzy and not function very well. You're not going to feel very well either. People probably have experienced this if their blood pressure medication is too high and it drops their blood pressure numbers too low. They start to get those sort of side effects or symptoms.
Hmm.
So anyway, it's all about balance there. But let's talk about some of the things that contribute to blood pressure. So there's really four main things that contribute to it. One is cardiac output. Now, cardiac output is just the amount of blood flow through your heart, during a sort of a given minute. So it's measured in liters per minute. But basically, it's the stroke volume times your heart rate. Stroke volume is just how much blood can your heart pump out with each stroke. And then your heart rate, obviously, is how many times it beats per minute. So you multiply those two together, you get your cardiac output.
Hmm.
So basically, it's just how well is your heart actually pumping out blood per minute. Now, there are a lot of things that can increase the contractility of your heart, and thus the blood pressure. These are going to be things like any sort of sympathetic stimulation, so that stress response, right? Catecholamines like adrenaline that are going to do this. Thyroid hormones are going to do this. Some other things like too much calcium can do this too. Calcium is what your muscles need, even your heart muscle, to contract. So sometimes if you have excess amounts of calcium, you can get this hypercontractility occurring. Now, the opposite is true too. The ways to sort of decrease your cardiac output would be parasympathetic stimulation. So that's like that rest and digest part of your autonomic nervous system. So it's kind of the chill part, right? Also, changes in your potassium levels and decreased calcium levels. All of those sort of decrease your output. So that's going to make more sense when we're talking about strategies on how to lower your cardiac output if your blood pressure is too high.
Mm-hmm.
So that's number one. Number two is peripheral vascular resistance. And this is kind of goes hand in hand with your blood vessel wall elasticity. So basically is how much resistance do you have outside of your heart? So all those other blood vessels that are outside the heart. So think of like a pipe, a metal pipe versus a balloon. So a metal pipe it's not very compliant, right? It doesn't have a lot of elasticity to it versus a balloon can contract and relax and, get larger and come back to its normal size really easily. That's what we're talking about when we're talking about blood vessel elasticity. Now, we want your blood vessels to be very elastic, right? To be able to handle that increased pressure and then come back down to normal. If it's not, that's a problem because that increases your blood pressure because you have more resistance. And so again, if you're doing that every day, day in and day out with every heartbeat for 10 years or 20 years, it's really going to wear on your system.
That's really interesting.
Yeah. This is part of what atherosclerosis is. So the sort of hardening of your arteries. Well, as those arteries get harder and stiffer, now they're less elastic. So they can't comply with increases in pressure because your blood pressure is a dynamic system, right? This vascular system is very dynamic. So it fluctuates a lot through the day based on what you're doing, your activities, you're up or down, you're moving, at a high rate, you're walking briskly or you're sitting. Like it's very, very dynamic throughout the day. So we want our blood vessels to be able to kind of expand, contract, and all that as needed. Well, as those arteries get harder, you're less able to do that. So consistently your blood pressure goes up.
That actually makes a lot of sense, especially like when I'm taking pulses from my perspective, because a lot of times I can feel if somebody has higher blood pressure just by how the pulse feels, like how the artery feels when I'm feeling the pulse. That's really interesting.
Yeah, it's really bounding when it's high, right?
It's like buzzy and bounding and like,
mm-hmm.
Just like strong and not a good way. I don't know how to describe it because I feel it all the time, but it's like an excess strong, way too excess.
Yep. Yeah, absolutely. Number three would be volume of circulating blood. So think of it like if you have sort of a closed system of pipes and you add more water to those pipes, you're going to increase the pressure in that closed system. That's basically how this is working as well. If we increase your blood volume, the amount of blood that you're circulating around in your body, we're going to inevitably increase the pressure, especially if your arteries are a little stiff and they're not as elastic as we want them to be. That can happen. You also have these stretch receptors in your heart. They're called baroreceptors, and they sense changes in pressure. So when these receptors in your heart sort of stretch and they sense that increase in pressure, it actually signals your heart to start beating faster to get that blood flow out. So it's going to raise your heart rate. And so now you've got high blood pressure and high heart rate at the same time, which is not great for your blood vessels. And that's one of the things that some of the blood pressure medications kind of work on. And then the last one is viscosity of your blood. So just kind of how thick is it? The normal blood viscosity is about 5 times greater than water. But you can imagine if you further increase that viscosity, sort of the thickness, you're going to get resistance to flow of that blood around your system. So think of it as like the comparison between, say, water and honey. If you're trying to push honey through a pipe, it takes a lot more pressure to do that than if it were just water. And so viscosity can play a big role in sort of that peripheral resistance or how hard your heart has to work in order to pump blood through your system.
I've never heard anyone talk about viscosity before. It's really interesting. I mean, when I was in
Mhm.
school, we actually had a classmate and we don't do this in practice very much. We were doing bloodletting because we were learning the ancient techniques for certain things. And they actually told him to get checked because his blood was really, really thick, like way
Mm,
thicker than it should have been. And like
yeah.
there was like stringiness. I mean, it was weird. It was a weird deal. They said
Mm.
it looked like fat or something coming out of the blood vessel. It was very odd.
Oh wow. Yeah,
But
that is odd.
that viscosity though
Yeah.
was very interesting. And the teacher's like, yeah, you should get that checked. Like,
Yeah. I mean, this is one of the reasons why you want to stay really hydrated. You don't want to be dehydrated because when you're dehydrated, yeah, your blood volume goes down a bit, but the concentration of the proteins and the components in your blood gets more concentrated. So that's going to increase the viscosity in your blood. So it's going to make it harder on your system to pump that blood around in your blood vessels.
mhm,
So staying hydrated can really help with that viscosity.
that makes sense.
Yeah. All right, all those four kind of components there make sense.
Yeah, for sure.
Yeah.
And it's funny because from the Eastern perspective, they really didn't know a lot about high blood pressure because they didn't have blood pressure cuffs.
Mhm.
So if somebody had, and you'll talk, I'm sure, about numbers later, but if somebody had like right on the border, they had type 1 high blood pressure, hypertension, like you wouldn't
Mhm.
ever be able to tell. You could feel in the pulse that there's some stress going on or something, but you wouldn't really know what was going on. So usually they would know by the time it got to the point of severe headaches and dizziness, which is not a point you want to be at with high blood pressure.
Yeah.
Um, and that's when they figured out, like, okay, there's an issue. Like, we need to take care of this. But to them, it didn't matter because a lot of the diagnoses are the same as some of the other ones you've heard.
Mhm.
So you were talking about sympathetic response, huge in Chinese medicine is a sympathetic response in dealing with that. Liver qi stagnation, liver yang rising. That's the words we use.
Dang it. I was going to say kidney.
Actually, kidney does get involved, which makes sense for high blood
Of
pressure, by the
course.
way. It
Uh,
makes sense.
oh yeah. I mean, from the Western
Yeah.
perspective, kidneys are a big part of blood pressure.
They are. They are. So in Chinese medicine, it actually starts with that emotional stress with the liver, and it can also start with bad diet, which is spleen and stomach. So you're talking digestion, and you're talking stress, constant stress over and over again. Eventually, then it can start affecting the kidney, and then you get this feedback loop where it's like you're having all this stress that's raising your blood pressure, and then it's actually hurting your kidneys, which is raising your blood pressure more.
Mm. Mhm.
And so you actually treat all of those things together. But if you catch somebody early, you're treating mainly the diet and the stress components, basically the things that people can control before they have to get on medications.
Hmm. Okay. Well, that makes sense. Again, like you're saying some of the same things, just in a different language.
Isn't that funny?
Yeah.
Isn't that funny? It's
Yeah.
like every single week it's like that, but it's true. It's very
Yeah.
similar because they knew a lot of what was going on. So, we aren't to treatment yet, but as far as diagnosis goes, it's going to be, liver, kidney. Eventually, the heart gets involved, but it's actually not the focus in the beginning because in the beginning, it's not like you said, it takes time to damage. So
Mhm.
in the beginning, you're treating these peripherals to try to bring it down before it gets to the point of damaging the heart.
Yeah. Yeah, I can't say that enough. Like, it's really about prevention here, like seeing some of the early signs, just getting your numbers checked because sometimes you don't see symptoms, right, at all
Mhm.
until it starts getting pretty high and you start having headaches and, some of the other symptoms that go along with it. Sometimes changes in your vision, lightheadedness or dizziness. So it's like by then, those numbers are pretty high, but they
Yep.
could be high for quite a while before you become symptomatic. And sometimes people aren't symptomatic until they have their first heart attack. And
Yep.
that's when they know they had high blood pressure too. So it's like this is one of those things where you really need to know your numbers, especially if you have any sort of family history of hypertension, which most of us do. Like this is pretty prevalent in our society for a number of reasons that we'll get into in a bit. But yeah, if there's any sort of predisposition, you should check these numbers early. I
Mhm.
mean, I had a friend in college who played football, and he started getting these headaches, and we thought it was just like related to just playing football. You get hit a bunch. You kind of live with headaches. We experienced way more concussions than we should have. But anyway,
Mhm.
so you just kind of chalk it up to that. And we ended up finding out through one of the trainers that, he actually had very, very high blood pressure and it ran in his family. And he was in his 20s, so like it's never too early to start getting a sense of what your normal numbers are.
Yeah, and not to scare people, but this is something you want to get checked. I am going to scare you a little bit. I mean, I had a family member that you were talking about this. It's absolutely true. I had a close family member that didn't even know she had high blood pressure until she had a major stroke.
Mhm.
And when she went in, it was like 240 over 160.
Phew. Yeah.
She had never gone to the doctor for 40 years, 45 years. She's like, I don't need a doctor. Doctors are dumb. I don't need a doctor. And by the time they found it, it's like, what are you going to do at that point? It's like she'd already had a stroke. It's already through the roof.
Yeah.
Life altering
Yep. Yeah.
disease, and just
And
didn't
at
know
that
it. No clue.
right. And at that point, there's no going back. The damage is done. I mean, you can try to do the best you can from that point on, but this is what prevention is about. This is figuring out what those things are that you're high risk for, and having an action plan in place to prevent that stuff from happening, or at least lowering your risk as much as you can. It's not like
Yeah.
your risk is ever going to be zero, but a 10% risk versus a 40% risk is quite a bit of a difference. So.
In Chinese medicine, kidneys have to do with genetic stuff too. So we're getting back to the kidneys again. You always ask.
See, I told you. I knew the kidneys were in there somewhere.
You know the answer.
That's going to be my answer every week.
It should be. So you kind of went into the mechanics. So what's a normal blood pressure? Like if somebody's measuring at home, what do you want to see? You said below 120 over 80, but what if somebody say is
Yeah.
130 over 90? Is that something to worry about?
Yeah, so let me go through. So there were some new classifications that came out. I think it was 2020 that the last new ones came out. So normal is still considered less than 120 over less than 80. Now, elevation now can be if you're above 120 and your bottom number is still less than 80, that's still considered hypertension. It's considered, I'm sorry, it's considered elevated blood pressure without the diagnosis of hypertension. So it's a slightly different categorization. The next one is what's considered stage 1 hypertension, which is anything over 130 over 180. So 130 over 80 or above, basically. And then you've got stage 2, which is 140 over 90 or above. Now it only has to be one of those numbers. So for stage 1, if your number is over 130, but you're less than 80, that's still considered stage 1 hypertension. So it used to be you had to have both of those numbers over, but now it just has to be one or the other.
So it's changed. Wow.
Yeah,
That's changed
it
from
has
when I was
changed.
younger. Yeah.
Yeah. And then a hypertensive crisis, which is where you need to seek immediate attention, is going to be over 180 on the top number and over 120 on the bottom number. So that can be pretty serious. That's kind of stroke, level type of hypertension, especially if it's gone on for any length of time.
Which it probably has if people just are finding it.
Yeah. So those are the sort of the current classifications based on sort of the American Heart Association.
Nice. So that's kind of the diagnostic part. So how about, lifestyle? You're mentioning lifestyle stuff. What do you look at as far as lifestyle? If somebody comes in, they're right on the border, maybe low hypertension.
Yeah. So lifestyle stuff is, it's a lot of what most of us already know, right? So if we start with exercise, we know that just walking 30 minutes a day briskly can lower blood pressure consistently. Now it's not a ton. It's like 4 to 6 points on the top number and like 2 to 4 points on the bottom number. But every little bit here really counts. So the strategy is always to do a number of things and not just depend on one thing. In 30 minutes a day, come on, that's not much, right? So it's not a lot to expect from somebody. I mean, if you're not briskly walking 30 minutes a day, something's wrong already. Like you need to get out and move, unless you have some kind of disability or injury that's prohibiting you from doing that.
It's a
But that's a
sitcom,
great.
people.
What's that?
It's a sitcom, people. Come on.
Yeah, right. Exactly. Just get up and move for a little bit. That's just that we go back to that sort of blood vessel elasticity, right? So that's again helping your body increase and sort of contract and relax those blood vessels. So during exercise, yeah, we do increase your blood pressure during exercise, but it's for a good reason. And then when you're done, your blood pressure decreases. So we want to get some of that, increasing blood pressure, decreasing blood pressure back and forth that maintains some of that elasticity. Okay.
Mhm.
So there's the exercise part. Diet wise, this is where sort of the DASH diet comes in. This is the diet that is used for hypertension that basically follows this premise of lowering your sodium levels, increasing your potassium and magnesium levels, basically by eating a lot of fruits and vegetables, which are going to have a high amount of potassium and magnesium in them. So by doing so, you're eating less processed foods, which are going to have a ton of sodium in them. That's what we want to try to avoid, is a ton of sodium. So anyway, by doing that, kind of flipping the sodium, potassium, and magnesium, then that can really lower your blood pressure.
Oh, interesting.
Also reducing just caffeine and other stimulants, in your diet can help too. Remember, caffeine it's like liquid adrenaline, right? So it's going to increase that sympathetic tone or that sympathetic system, which is going to make your heart contract harder with more force, and it's going to contract your blood vessels. So it's going to increase peripheral resistance by contracting your blood vessels, and it's going to increase cardiac output, which is contracting that heart. That's why it's great for exercise, right? If you have a little caffeine before exercise, you feel like you just get a little bit better exercise. Well, that's why. It's because it's doing all of those things that help increase your blood pressure, which during exercise can be helpful, but not when you're just sitting there watching TV.
So no 2 pots of coffee just for fun.
No, I tell you, one of the first patients I saw in Alaska was this guy. He worked at the border of the Canadian border. And, he's in one of those guard stations where it's just like in the middle of nowhere. And they have these weird sort of cycles where they're on for like 8 or 10 hours, and then they go sleep for a little bit and they come back for another 8 to 10 hours. Anyway, it just flip flops a lot. So he was drinking literally 2 pots of coffee or more per day just to stay awake.
Oh, wow.
And he came into the clinic and his blood pressure was very, very elevated. And he was tired. He was just wore out.
Wow.
But his blood pressure was crazy, crazy high. And I was like, man, we've got to figure out a way to keep you awake without the coffee. So it was a challenge, but we got him off the coffee. But it was astonishing. I had never seen anyone drink that much coffee before.
Yeah. That's really interesting. And it's kind of the same thing from our perspective, is you're going to start with lifestyle stuff. I mean, I'm going to do acupuncture too. It's going to help. But early on, just changes in lifestyle, and Chinese medicine's kind of the same. You're eating less processed foods. You're eating, more whole foods, fruit, vegetables. You're decreasing your stress and you're moving. And that's really what we're going to focus on in the beginning when you're not coming in to see me.
Right. Yeah. Like I said, a lot of this is real basic stuff, but most of us, we try to do our best, but we're not very consistent with it. I'll tell you, I'm in that boat too. And so it's a challenge just to stay consistent with all the things that you need to do to be healthy. But that's why it's important to watch your numbers too, to track this, because we're trying to do the best we can, but sometimes that's just not enough, unfortunately. And we have to understand when it's not enough. And as we get older, it's going to take more for us to stay healthy. So it's even harder. And if we're just not able to do that, sometimes that's when we have to be much more aggressive, and where lifestyle modifications just aren't going to be enough. or we can't do them enough to actually move the needle, as much as we need to. So that's where we have to use nutrient therapy or supplementation or even medications in order to lower that. Because remember, it's all about reducing your risk as much as possible.
Hmm.
Sometimes the best medicine is a medication if you can't do enough of the lifestyle modifications or they're just not being effective at that point in time. Granted,
Yeah.
the earlier you can start them, the better, but sometimes they're not enough and
Mhm.
you have to move to a medication.
Now, before we get into treatment, you had mentioned kidneys before, and I'm guessing a lot of the listeners are probably may not know how in the world would kidneys be involved with blood pressure? Because you always think heart, right? So how would kidneys be involved?
Yeah, so kidneys have to do with that peripheral resistance, right? So remember, it's filtering. Your kidneys are basically filtering your blood, so they have a lot to do with how much your how much water you're urinating out, which is going to deal with sort of the concentration of the blood as well, and how much proteins are like kind of going through, and how much protein stays in your bloodstream. So it's really vital that there's this system called the renin aldosterone um, uh, system, and it has to do with just that sort of the solutes and how sort of thick your blood is. A lot of that has to do with your kidneys. Um,
Interesting.
so yeah, so kidney health is extremely important. Now here's sort of this vicious cycle that you can get into is if you're not healthy and you see your blood pressure is consistently on the higher side. Well, one of the first places that we see high blood pressure damage systems is these small blood vessels that are located in your kidneys and in your eyes and other places too. So if we're seeing the first effects we're going to see from high blood pressure are going to be in these small arterial systems. So you're going to get a small amount of kidney damage. Well, you get kidney damage. Now it makes you less effective at managing your blood pressure through the aspect of your kidneys, and that's the sort of solutes there,
Hmm.
which just makes your blood pressure worse, which makes your kidney damage worse. And you can see how this becomes a really vicious spiraling cycle here.
Yeah, and I actually, I think I mentioned before, but not a lot of detail. That's actually what happened to my mom, and it's happened to one of my friends too. Is that had high blood pressure for years, didn't know it, started to damage the kidneys, which made the blood pressure higher. Had a stroke, and it was like this back and forth where she ended up with severe renal failure and
Mhm.
dialysis because the blood pressure had been spiked for so long and the kidneys had been damaged for so long that it just fed on itself. So she
Yeah.
had this constant high blood pressure along with the kidney failure by the end because it just over 20 years it wore down.
Yeah. Yeah. And that's I see this happen a lot where some of the first signs we start to pick up on are kidney failure. And so we see their GFR, which is the filtration rate, start to really go down. And that can be signs that, or we see sort of micro amounts of proteins called microalbumin show up in their urine. Like those are signs that we're starting to see some small amount of kidney damage,
Mhm.
and even more reason why you want to be much more aggressive on trying to treat this and keep that blood pressure down as low as you can.
Yeah, and you mentioned urination. It's interesting because a lot of the Chinese herbs that you use are actually diuretics. They will actually help eliminate more fluid, at least mild
Mhm.
diuretics, and
Mhm.
that's kind of how they work to reduce blood pressure. It's interesting.
Yeah, yeah, and that's how some medications like you've got diuretics like HCTZ, that's a common one used, hydrochlorothiazide, and it's a diuretic, and so what you're doing there is trying to reduce the the full blood volume, so the amount of
Mhm.
sort of water in the system, right? By
Mhm.
doing so, you decrease the pressure in the system. So
So moving into treatment, since we're kind of moving that direction, you
yeah.
get to the point where lifestyle isn't enough, and you realize that you need to, kind of bring the hammer and do something a little bit more. What do you do next as far as either supplements or medications? You mentioned a little bit there, but
Yeah. So some supplements I really like to kind of start with. There's a few of them. There's some great research, and I had some good experience with garlic, berberine, which we've talked about on here before, as far as blood sugar and cholesterol. There's actually some good research on berberine reducing blood pressure as well. So honestly, at this point, with all the great stuff, it's like I have probably 80 to 90% of my patients on berberine. Fish oil is another good one. It's very kidney protective as well. Magnesium. Remember, magnesium, if we had to kind of simplify things, calcium helps muscles contract and magnesium helps them relax. And so that's really an oversimplification, but for all intents and purposes for this conversation, let's make it work. But so if you get enough magnesium in, that does help reduce the blood pressure, right? Mm-hmm. Because of that relaxation effect. So that's a great one. Another one that's really strong is it's called Rauwolfia serpentina. It's a really common antihypertensive that we use. Basically, it reduces the level of catecholamines, those hormones that help increase blood pressure, like adrenaline and cortisol, like those types of hormones. So it helps to reduce those. By doing so, it's going to decrease your sympathetic tone, which is going to reduce the contractility in your heart and reduce the peripheral resistance by relaxing your blood vessels a little bit more. That's a pretty strong one. There's a product called Carditone by Ayush. It's one that's been around for a long time that a lot of us use pretty often. Mm-hmm. But those are some good ones to kind of start with. Maybe you can use diuretics too, like I'm blanking on a few of them now. Dandelion is a great one. It's one that works really really well. When I was in med school, I actually did this project where I just collected a bunch of dandelions and dandelion leaves and made my own sort of tincture out of it. And then we actually had to dose it and then track our urine output before we started the project and during the project, and actually saw a really significant increase in urinary output. So how much you're kind of peeing out, which would lower your blood volume. And we had to account for, how much water intake we were taking in as well.
Yeah.
But I was really astonished to see like how strong sort of herbs can do that. They can be pretty powerful. So they're great to use as sort of first line therapies along with lifestyle modifications to really drop those numbers pretty significantly. And if that doesn't work, then we can jump to some medications. And when we get to medications, I know this is a big point of contention for a lot of people. Like, oh, I'm never taking blood pressure medication. It's like, people feel bad. They get symptoms. They just feel more fatigued. They get erectile dysfunction. It's like, I hear all kinds of stuff. But I have to tell you, like, there are different classifications of blood pressure medications, and there's different sort of strengths to those classifications. There are some really mild, great sort of second line medication therapies that most people don't experience any symptoms with. And if they do, they're very, very minimal compared to, what you would get with high blood pressure. So there are some great medications out there that you can start with that you probably won't even feel the difference while taking it, besides lowering your blood pressure, which would be great.
It's better than not, it's better than dying. There's a little bit of symptoms.
Right. Yeah.
I mean, you have no symptoms once you're dead, but you're not alive. So there's that.
Right. Yeah, there's that. Deal with the side effects and deal with that. Yeah.
Exactly. Zero side effects.
Yeah. So it's just in my line of work, I hear a lot of not wanting to use medications, and I'm for that too. I'm not against medications, but they're never my first line therapy, and they're always there if we need them, but we try not to jump straight to that. And so that's what people need to understand too. It's like you always want to do what the best medicine is. Trying to figure out what that is at this point in time sometimes can be difficult, but that's what you should be striving for. And sometimes that's lifestyle modification, sometimes it's herbs and supplements, sometimes it's medication, but you just got to figure what that is.
And when I work with hypertension in general, a lot of times I'll actually spot it in the pulse. Like somebody won't even realize they have high blood pressure, and I'll feel
Mhm.
their pulse, and it just there's a certain feel. I've been practicing long enough now. I was talking about this with one of my colleagues that like there's a certain feel in the pulse that when I feel it, I'm like I'm pretty sure they have high blood pressure. Like it's a
Mhm.
fullness, but there's also it's hard to describe unless you feel pulses, but it's like a buzz. It's buzzy.
Hmm.
It's like the tautness of the artery. There's this buzz to it that you don't get with a normal,
Yeah.
a normal pulse.
Yeah. Now, do you check their blood pressure if you feel that to see
Yeah.
what
Oh,
it
yeah. I can
is?
check
Or
their blood pressure, and I also
yeah.
tell them because a lot of times the problem is they're relaxed in my office, so
Mhm.
it won't be a good read of what they're like every single day. So
Mhm.
I'll also tell them, you need to check at your doctor's office. You need to check at home. I almost always refer out to a doctor just to make
Mhm.
sure that it's being kept an eye on,
Yeah.
like no matter what.
That's a good point is monitoring. So oftentimes, if you just go to your doctor and you get your blood pressure checked and it's a little high. Well, it's not really good practice to make clinical decisions based on one data point, right? So you want to get tons of data points. So what I typically have my patients do is, hey, let's get a good cuff to have at home. You can get these automatic cuffs, and start checking it twice a day at least for the next week to 2 weeks. So ideally, I'd like to get 2 weeks of data twice a day. So first thing in the morning when you wake up, and then again sometime in the late afternoon, early evening. Typically, when most people's blood pressure is going to be a little bit more elevated later in the day. So that can give us a good idea of kind of what the range is on their blood pressure. As soon
Yeah.
as you wake up in the morning, it's probably going to be on the lower side until you get up and get moving. So it's a great time to kind of check your base level. And then again, like I said, in the late afternoon, early evening, and then do that for 2 weeks and just plot those data points out and see what your ranges are. Then we've got a better sense of what's really normal for you. And then we can make better clinical decisions based on that information instead of kind of just shooting in the dark going, yeah, I think you might have high blood pressure. So let's put you on this medication. Well, it's like, get a better sense of really what it is. That can help, direct what sort of methods you need to implement first.
And it's also good because people tend to get white coat syndrome. And
Sure.
so they'll go
Yeah.
into their doctor's office and their especially their top number, will read really high. And the doctor will just assume
Mhm.
you must have hypertension. But if you were to test it at home, it might be slightly elevated, but it wouldn't be hypertension. It
Mhm.
wouldn't be high blood pressure.
Yeah.
Um,
Yeah. And I've seen that happen. I've seen, some doctors give their patients blood pressure medication because it was pretty high in the office. They started taking it and they start experiencing symptoms of low blood pressure. And that's because that wasn't their normal. And remember, blood pressure is really dynamic. What we want to do is try to limit how dynamic it is, so the extremes, and then what your normal is throughout the day, sort of your average is through the day.
yeah.
That's how we're going to decrease the risk of damaging your arteries.
Yeah. Yeah. So I'll check the pulse. I'll have them keep an eye on the blood pressure. I'll refer to someone like you usually if I think there's an issue. And then I'll do acupuncture. I may or may not do Chinese herbs. And the reason is Chinese herbs are actually very effective, but sometimes too effective. So you have to be careful that you don't go overboard, especially if they're on other supplements, other medications. It's like it'd be like throwing in a diuretic for someone who didn't need one. And then all of a sudden they're peeing more and they get those low blood pressure symptoms
Yeah,
because you didn't pay attention to the fact that you're using things that are synergistic, things that work together
mhm,
and will amplify the effects of the others.
yeah, yeah, yeah. That's great. That's a good reason too to sort of do these strategies in periods of time and continue to evaluate. So what I like to do is like, hey, if we're going to have a treatment plan, so let's say you're going to go out and you're going to walk 30 minutes every day after dinner, okay, briskly. And then we're going to try to change your diet. So we're going to try to get more fruits and vegetables in, less processed food, less sodium. You're going to stop smoking. We're going to try to sleep better, manage your stress. All right, we're going to try those things for let's say a month or 2 months, and then we're going to check your blood pressure again and see if we're actually seeing some changes in those numbers over time. again, that gives us great feedback to determine, like, hey, are these strategies working? If they are, we're starting to see some improvement. Maybe they just need a little bit more time to really get down to the numbers we want to see. Or maybe they're just not enough and we have to be more aggressive. The sooner you can determine that, the better off you are.
Yeah, for sure. I completely agree. Like adding one, a couple things at a time, working with your doctor, it's all really important. There's been a lot of studies that show acupuncture is really, really beneficial. Acupuncture in general is really beneficial for high blood pressure, especially the points that are going to activate that parasympathetic. You're talking about the resting.
Yeah.
That's what we're
Yep.
going to do is really activate that.
Yep. That's what I'm thinking. Like, man, acupuncture would be awesome for this, just for the fact that it helps induce that parasympathetic stimulation, which is going to lower your blood pressure and your heart rate. So,
Yep. And the good thing is it also lasts for a lot of people. It's not just because a lot of people are thinking you get acupuncture, like parasympathetic kicks in, and then you leave and it goes right back up. Not necessarily the case. A lot of times it lasts and it lingers. And a lot of it depends on your lifestyle too. So if you're adding in lifestyle changes and you're getting acupuncture, it's going to be a lot more beneficial because you aren't going to have the sympathetic nervous system pushing everything back up, within a couple hours of leaving.
yep. Yeah, I totally agree.
So the points we'd use, are points that are going to help move energy. So liver 3, large intestine 4. So it's called the 4 gates. Teach you a little bit here. I'm going to describe it for the people listening, but right in the meat of the web of the hand, on top of between the thumb and the first finger, there's a point there. It's tender, hurts. That means you found the point. So that's a really good one. And then between the first and second toe, there's a tender point that I'll say, not going to use medical terms, north of the web, you will feel that point.
Okay.
So,
Now, are these points that you can sort of use acupressure with? Like, you can
they
pressure
are.
yourself to help?
Yes.
Yeah.
Acupuncture is more beneficial, but if you're at home and you don't have an acupuncturist, absolutely you can press on them. You want to do a pulsing. So you don't just want to push directly. You want to pulse where you push, 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 push for about
Okay.
a minute on each point.
Yeah. Gotcha. Cool.
And you'll feel
That's
it.
easy
If
enough
you're in
to
the
do.
right place, you'll feel it.
Yeah. Oh, yeah, I bet. I'm going to do that right now.
Yeah, especially for people who have a lot of stress and tension.
Yeah.
Another good point is up by the elbow, the crease of the elbow, between the bone and the crease, halfway between, there's a point. So on the outside of the arm there,
Ooh, yeah.
and it's a tender point too.
Yeah, that is tender. Huh. Should check my blood pressure.
Well, also, if you have any inflammation, that point's going to be tender as well.
Yeah, that's probably it. I do have a little lateral epicondylitis too.
Yep. That's one of our main points for that. And we'll get into that in another episode.
Yeah.
But
right.
that's what I'm going to do is acupuncture, activating the parasympathetic, maybe herbs and lifestyle stuff, and then working with you.
Yeah. Okay. A few other lifestyle stuff I just kind of want to point out before we wrap this up is managing stress. We kind of alluded to that a little bit. I mean, come on, people. Like, we're all stressed, right? In different amounts. Like, I'd say 80 to 90% of the patients I see, I have them rate their stress level on a scale of 1 to 10. I say most of those are at a 7 or above most days out of the week. So most of us are pretty stressed. We need to start figuring out how to deal with it better, right? We need better coping strategies. And I think this is where most of us really lack. We don't do things consistently every day, like prayer, meditation, or deep breathing exercises, or exercise, or just like there are tons of different strategies you can do to reduce your stress, but we don't really practice those much. And I think that's I've mentioned this before too. When I work with patients, I try to get them to create a healthy day template where they're trying to like structure their day to help to improve their health for a number of reasons. But a lot of this has to do with sort of the core 4, which is nutrition, movement, sleep, and stress. So when we're talking about that stress component, like, what are you going to do during your day to address stress? Even on those days you're not feeling stressed, what are you going to do? Like, for me, just taking a brief walk out in nature, just taking some deep breaths, getting some sunshine, getting away, getting to a quiet place. Like, that really does a number for. I've actually looked at that. My blood pressure drops when I'm able to do that. So figuring out a strategy that works for you and being consistent with it really goes a long way.
No, I
The
agree.
other one is the other one is sleep. And I can tell you how many times I've diagnosed sleep apnea based on blood pressure readings. We see these blood pressure numbers cranked up, everything else looks fine. We start talking about sleep, like, yeah, I don't really sleep that well. I don't really feel refreshed when I wake up. We do a sleep study, and boom, like they've got sleep apnea. That's going to be a huge stress on your system. That's going to really jazz up your sympathetic nervous system, that sort of fight or flight system, and that's going to inevitably increase your heart rate and your blood pressure.
I'm glad you mentioned sleep. That's something I focus on with a lot of people in general. Sleep's going to be a big one. And it's a really hard one to fight. Like if you're treating someone and they're just
Yeah.
not sleeping well every single night, it's going to be really hard to effectively treat because you're just every night they're going to kind of be resetting to that bad place they're at.
Yeah. And this is one, I think, as far as, when we're looking at getting someone healthier, we have to look at the obstacles, right? So what are the things in your life that are contributing, that are sort of in the way of you becoming healthy? And poor sleep is at the top of the list. Like there's a reason why it's used as a torture technique, right? You can literally turn somebody crazy in just a matter of a few days of sleep deprivation. So it's really powerful. And if they're not sleeping well, then we can throw the kitchen sink at them as far as supplements and medications and all this, and they're going to be minimally effective if we're not dealing with the stress. So it's really, really important.
I have a funny story about sleep. I know we're running short on time, but when I was in college, everybody in college can sometimes be an idiot. And I was an idiot. And I decided I was going to see how long I could stay up. And I made it 3.5 days.
Oh,
I actually started hallucinating. Like the
mhm.
ceiling started coming down on me. I started having panic attacks. And I was so tired I couldn't fall asleep. Like when I finally lay down in bed, I couldn't fall asleep. It was the weirdest thing. My heart rate was through the roof. It was torture. It was terrible.
Yeah, because you're just surviving on that sympathetic system. That's why it's like you have a hard time actually getting to sleep because your body's just jazzed up. It's in survival mode, right? So it's just trying to stay alive.
So don't do that. Don't do
Don't
that,
do
people.
that. No, don't do that.
I was driving around too, so yeah.
Oh, yeah, that's not good.
Yeah.
I see this a lot in mothers too, especially with, newborns or toddlers, or they start, they have multiple kids, and so they're up at night and they're the ones mostly dealing with it. And so they get 2 or 3 hours of sleep, and then they're woken up, and they go back to sleep and they get an hour or two, and they're woken up. And it's like just that interrupted sleep for long periods of time, months to years, really can have a major additive effect and wear them out.
Well, any final thoughts? I know we're running low on time. I can't believe we went almost an hour again. It's crazy.
I know. Time flies when you're having fun. But
that's true.
No, that's pretty much it. We can have another episode where we go into medications if people want to really dive into the differences between those different categories of medications. If that's your thing, you want more information. I do see it's important because there's a lot of, I think, misinformation and just hesitancy when it comes to blood pressure medication for a lot of people. So if you guys want that to be clarified, let us know. I'm happy to kind of go through that in more detail next time.
Awesome. Well, thank you so much, man. This was a really informative episode. I learned some things, so it was terrific.
Oh, good. Awesome. Sweet. Well, until next time, guys, we'll see you next week.
Hey, thanks for tuning in.